Welcome, everyone, to today's Synergist webinar, Healthy Schools Town Hall. Ed Rakowski, editor of the Synergist, a magazine of AIHA. I'd like to thank all of our attendees for joining us today, and especially Safe Traces for sponsoring today's webinar. If you've attended Synergist webinars before, you should know that we have something a little different for you today. This webinar doesn't have slides. What you'll witness today is a discussion among 5 speakers with diverse professional backgrounds who are talking about a timely, immensely important subject, how schools and school districts can protect teachers, students, and staff during the COVID-19 pandemic and beyond. Our speakers today include Ali Talcott, Executive Director of BASIC, a coalition of civic, public sector, labor, and industry associations who support federal funding to help underserved public school districts. Alex LeBeau, a certified industrial hygienist and principal toxicologist at Exposure Assessment Consulting, LLC in Orlando, Florida. Carol Vance, a member of the Board of Directors for the Professionals in Infection Control and Epidemiology. Tracy Washington Enger of the U.S. Environmental Protection Agency Indoor Environments Division. And finally, Maria Godoy, our panel moderator, who is an award-winning health and science correspondent and senior editor with NPR News. Once the conversation starts, I recommend that you click the layout button in the top right corner of your screen and select the grid layout so you can see all the speakers on your screen. We'll reserve 10 to 15 minutes at the end of the hour for audience questions. Please use the chat in the lower right corner of your screen to submit your questions, and please indicate which speaker your question should be directed to. And I think I've talked plenty now, so Maria, the floor is yours.
Thanks so much. Okay, well, I am very excited to be having this conversation. It is urgent. We are having it as tens of millions of school children are back in school in person, in many cases for the first time in over a year. And this is all happening as a more contagious variant of the coronavirus is spreading across the U.S. And so I think we have a lot of questions. And I want to start with this whole idea, though, that we need to take a multi-layered approach to protecting kids in schools. It's not just one strategy that is going to keep them safe, but a collection of them, right? We want to be doing as many as possible. And so we hear public health experts talk about vaccination of eligible people, universal masking among students and staff, especially when indoors, and then physical distancing and cohorting, testing, et cetera. But one of the most important ones, and I think one that has been neglected for many years until now, is ventilation. And that is something I never thought I would be so excited in my life to think about ventilation. But as we've learned that this virus is, airborne and it spreads primarily indoors. It can accumulate indoors and linger for hours in the air. Ventilation suddenly becomes really key in terms of keeping people safe indoors. And so I want to kick off by talking about the hierarchy of interventions that schools can adopt to keep students safe. And really, I'm going to have Alex kick us off because he helped co-write AIHA's guidelines on this. So Alex, can you sort of walk us through those, that hierarchy and tell us about the role ventilation plays there? Alex, I think you're muted still.
Thank you so much. I apologize. I'd be happy to do that. Just an additional aside, I am currently the vice chair of the Indoor Environmental Quality Committee for AIHA, so I was able to help with some of those guidance documents that Maria had discussed. So I know a lot of people here, probably industrial hygienists. For those that are not, industrial hygiene is a recognition and evaluation control of things that are going to cause workplace and community sickness and discomfort and impairment of health. So what we typically do as industrial hygienists, we use the hierarchy of controls. So those controls involve the elimination and substitution using engineering controls, administrative controls, and personal protective equipment. If anybody's interested in seeing what those are, you can just go to a search and type in hierarchy of controls, CDC, and information will come up. We use these controls as a way to address issues that arise in different scenarios. So what we did is early on in the pandemic was the first thing we eliminated. The cause of the virus or the transmission was people. We shut down facilities, we shut down buildings, and we eliminated the potential for those transmission points to occur and accumulate in those facilities. Later on, we got to a more layered approach. We determined that there were other things that we could be doing to get those buildings back to work, I'll say. And AIJ has some guidance documents that are appropriately addressed back to work guideline documents that we have implemented and addressing different exposure scenarios. But it's important here to understand that there are different ways to address different exposures. And we know a lot that has happened over decades from different potential pathogens that impact facilities. COVID-19 is different because it's a new virus, but we have an idea of how to address things. And one thing we have identified, as Maria pointed out, is we have identified this as an airborne virus. It took a little while to get to that conclusion in some regards. Some places were very early on in the pandemic saying, this is very much an airborne, just based on the way we are observing things. Other institutions took a little while to get there, but I think we're all on board that it is definitely an airborne virus and transmission. The best way that we identify that using the hierarchy of controls is looking at primarily ventilation. What I like to do is I like to put the responsibility and the burden on the facility. Using engineering controls to do that is the most effective way. There are things that the buildings and facilities can do to appropriately address implementing those engineering controls. And AIJ has a guidance document out for using engineering controls in facilities to appropriately address and mitigate those risks, because that's industrial hygienists. We're all about evaluating exposures and mitigating risks. And we can appropriately do that using a layered approach. It's important to understand that there's no one size fits all model for this. Different buildings are built differently. One building may be 50 years old, one building may be 5 years old. You can't use the same way to address each of those buildings. You have to do that individually, and they have to be assessed differently. Even buildings in different parts of the country. One thought is to use outdoor air for bringing in fresh air. Well, down here where I am in Florida, it's hard bringing in that outdoor air because it's so humid down here, the systems may be working too hard. It may be easier in a cooler part of the country. So you have to very much address and understand the area that you want to control and how to control it for the facilities.
Do you think that everyone has gotten this message by now, though, that improving ventilation and filtration in schools is really, really key? Is that out? Are schools acting on it? And are they getting access to the expertise they need really to help make those improvements?
I'd say I like to hope they are. I know that there's a contingent of us who will reach out to these schools and speak to them. And I've spoken to some schools. I've spoken to some even private institutions around here, some private schools, and said, these are things that we can do. I'd be happy to help you out. Just let me know, because it's all about making sure that they understand how their facilities can be the efficiency of their facilities can be maximized for reducing risk in those. I think the message has gotten out to a certain extent. I think today's goal is to understand that we can reach that we can expand that, and there is a need for these places to understand that there are not only appropriate things to do versus inappropriate maybe controls or ventilation devices that may be out there on the market, but there are efficient things that can be done even both on the short term and long term to address these risks.
Right. Well, what sort of short-term things are you talking about?
Sure. Well, short term, it's going to depend on the facility. You can have an evaluation done. Again, it may be introducing, outside air, opening doors, opening windows. It may be bringing in recirculation devices within the facilities. Those can be short-term goals. It can be increasing the filtration or type of filters that are used if the systems can handle them. You may encounter an HVAC system that's 30 or 40 years old that may not be able to handle additional filtration. So you may have to bring in these other units. Evaluating those systems as well is important. You want to make sure that if you have short-term solutions, you're not causing any other problems. You're not bringing in something that is set up in the classroom or the building that's going to perhaps short circuit or create a stagnation in the building. It's important to understand that you can't just bring in an air filtration system and put it in the room and expect it to do its job. They have to have people who understand why it's in there, how it's designed, what it's doing to make sure it's maximizing its efficiency.
Well, so, and this is a question for you too, Tracy, how do schools know that they're getting the right expertise, that they're getting the right advice from the right people? Tracy, I think you're muted still.
How about now?
Perfect. Perfect. Now I can hear you. Yes.
Yeah, so everything that Alex said is right on target. And when we talk about, right now, when you ask, are schools doing these things, right? So this is what my entire career has been about for the last 25 years, introducing indoor air quality tools for schools to schools so that they would have a comprehensive indoor air quality management program in place, right? And it's been sort of an uphill battle because schools face all kinds of different challenges with their budgets and with their priorities and with their attention. And so deferred maintenance has always been a really big problem with infrastructure and with HVAC systems. And that's kind of why we are where we are. So what we knew going into this at EPA based on our program was that when, as of 2018, we knew that about half of the schools in the country had something that they called an indoor air quality program. And of that half, but there are many things can be called an indoor air quality program, but that was even progress from 20 years before when people weren't even really, everybody has an indoor air quality program. Whether you recognize it, named it, and are doing it with intention is another story, right? So what we found was that about 75% of those were actually, it was an indoor air quality program that met the basic standards of what we recommend in terms of having an indoor air quality program. So that's about half the schools in the country were doing something. Those schools who are doing it and really doing it well are the ones that we're seeing, of course, faring best now because they were grounded in a long-term comprehensive program that was based on, providing healthy indoor air. So now that it's time to pivot, everybody's talking about how we pivot to meet the pandemic. You can't pivot unless you have 1 foot grounded, right? If you don't have that 1 foot grounded, you're not pivoting. You're just spinning out of control. And we're seeing some of that too, right? So when you ask, what are the things that people can do? Alex sort of alluded to, he spoke specifically to the things that we've been partnering with CDC on in terms of giving messages to schools for what you can do immediately, but also thinking about as you're doing these immediate interventions that they can and should have long-term outcomes, long-term health impacts, long-term facility impacts. We can do this. This is our moment to do this, right? So when the CDC says, 3 top things that you want to be looking at, bringing in more outdoor air for dilution, right? You want to be looking at enhancing your filtration as high as your system will allow. If it will allow a MERV 13 or higher, definitely do that, but know your system and put the filtration in at the highest level that your system will allow, which means, again, knowing your system. This is the time to get intimately acquainted with your HVAC and ventilation systems in every school, in every district, right? And then the third thing is then looking at supplemental air cleaning or supplemental ventilation, right? So those are the 3 top things. Thing is, there are lots of steps to tailor those 3 things to make them most effective for your facility. So that is really going to be the key. Looking at those 3 major areas, looking at all the different strategies underneath it and underneath each one of them, and then tailoring those to your specific circumstances. And that's where tools like indoor air quality tools for schools come in, where the ASHRAE standards and the ASHRAE assistance comes in, where, the hierarchy comes in. Because really, we talk about ventilation under the engineering, controls in that hierarchy, but indoor air quality overall lives in that entire hierarchy. It is how you are doing your administrative controls. It is how you are doing spacing in your schools. It's how you're doing scheduling in your schools. It's how you're making choices about things like masking and where and when and how much to give your ventilation system, to give your engineering controls a fighting chance. You also have to be comprehensively doing the administrative controls as well. So, I'll turn it back over to you to go to another question, but I'll just say, everybody right now is saying, oh, it's so complicated. Indoor air quality is so complicated. Early on in my career, I remember an instructor who was, this specialist in indoor air quality, and he says all the time, he says, Indoor air quality, there are lots of components to it, but really it's not all that hard. It is airflow in, airflow out, understanding how that works, and then doing the best thing. People are complicated, right? And so you want to really make sure that you are training your staff, make sure that folks are getting the message and that you're all kind of working together on that administrative side so that when it's time to do the engineering side, everybody's on board.
Right, right. Well, we have been talking about some sort of best practices for reducing the risk of COVID-19 indoors. But there are some schools that don't even have windows that open. I mean, that's something that I've learned. Like, there's some really basic structural challenges. Can you talk about some of those existing challenges facing schools? Because, as you said, like, not all of them have great indoor quality programs. Many don't. And there's just such a broad array of schools across the country and, like, how much resources they have or don't. Yeah.
So sure, I'll start that off, and then I'm going to kick it back over to Alex, who I know has had lots of experience in different schools as well. So yeah, it's not like schools wherever, most schools have not been highly resourced, financially. They have had, they've all, had these different issues. However, the thing is, and again, this comes back to there's no like one handful of things that we can say, this is what you do and it's all going to be okay. There are, though, probably a handful of things out of the plethora of interventions that you can do that are going to be right for each facility. It's not even at a school district level. It really does have to be at a facility level, and that's the message that I would just keep pressing home to people, because even within a district, you're going to have some schools that have top-notch, brand new HVAC systems that are being well maintained and everything is great. And you're going to have others where, the facilities are 60 years old, they haven't been maintained. But within those, that's why it's really important to use something like the Tools for Schools guidance, like the ASHRAE guidance that takes you checklist step by step. That's what we were trying to do, simplify a complex system with step-by-step checklists and items for people to look at. And it really starts, though, with getting your staff, your facility staff together, figuring out what they know and don't know about and what they can do and can't do when it comes to providing the healthiest, maximizing outdoor air, maximizing enhancing ventilation. Some of those things, some districts and some facilities are going to be able to do with their staff inside, and others that you're going to have to look out. You're going to have to go out and acquire that assistance, and it is out there. And that's where especially our industrial hygienists are going to be so useful in this process, because they can help school districts figure out how to address this, not just from an immediate, facilities engineering point, but also from a health standpoint that is going to help them make choices and make investments that are going to give long-term returns in health outcomes. So that's, I think that's the really critical thing, is really taking the time to do a tailored approach for each of your facilities.
Right.
Alex, give me an amen.
Sure. No, Tracy, you're exactly right. There are, as you said, there are a handful of things that, schools can look at and do. And Marie, you said not every school is going to be designed the same, but and this goes back to the maintenance or the lack of maintenance and understanding your systems. You may have a system in your facility you think can handle the load, but you may find out that the fan in that system hasn't been cleaned in 10 years and it's not operating at maximum efficiency because there's just been a lack of maintenance, a lack of understanding of the system, or just a lack of ability to take care of that system. So it's important to get in there to understand what systems you have in place and what they are able to do. And a lot of times facility people do have that understanding, and working with your facility individuals to understand where you are and where their systems are is crucial. Another thing that is important to understand is the facility people may have a good idea on the design of the systems, but it needs a holistic view of that facility. There may be facilities that are set up in such a way that there may be pressure differentials between rooms. There may be one that's in one that's next door is positive versus negative pressure, and air may be pulling in from one classroom to another, and people may not even understand or realize that. It's important to
Yeah.
understand, you may be keeping a door open thinking it's the proper thing to do, but you come to find out you're actually creating more problems by keeping that door open
Right.
than it would be, because it's very much tailored for your facility. So one thing that I like to point this out is industrial hygienists or occupational health and safety professionals. We look at recognizing, anticipating, evaluating, and controlling exposure. But one last thing that some people tend to, it kind of trails off, is confirming. We want to confirm that those controls are working appropriately. You go in there, you confirm it. You use instrumentation. Safe Traces is a sponsor here today. I have no affiliation with them, but I've seen some information they put out, and it's very interesting what they're able to do. They are able to use surrogates for going in there and evaluating the effectiveness of the systems, confirming that the systems are operating as they're designed, or showing showing areas where you may need improvement. I think that's crucial for determining the systems in your schools, not only putting these systems out there, but making sure they're working as you intend them to be implemented in the facility.
So I want to ask, in terms of figuring out, because, as you both have said, like not all size fits all, not one size fits all, rather, for schools, and one solution that's great for one school may not work for another. How do you feel, one thing that like aerosols experts have recommended to me in my reporting is that schools purchase and use CO2 monitors to get a sense of, the ventilation in their rooms, as sort of an easy way to figure out if the system is working as well as they think it is. How do you feel about that recommendation? Is that something you think is wise?
Well, actually, that's one of the questions that came up in the chat here as well, asking you about your thoughts on yeah, so you're right on target there. So it is one of the things that, especially as we continue to see schools making higher and higher investments in indoor air quality and indoor HVAC systems, and understanding this better and having really informed customers around this, right? There are lots and lots of monitoring that can be done to give you information about how well you are, how well your interventions are working, right? So there's a hierarchy there as well, right? CO2 monitors, I think, are one of the things that are right at the sort of at the beginning of that that continuum, and they go all the way up to all kinds of continuing monitoring devices. They can look for numbers, any number of different pollutants or conditions, as well as ones that can also be continuously monitoring your energy use, and then combining those things. But as far as CO2 is concerned, it is a decent proxy. Recognizing it as a proxy, right? It's a decent proxy for, as you're starting to understand your building, starting to understand your system, starting to understand the flow that's going on there, to give you an idea of, how well ventilated those spaces are, to provide information to help you make other decisions as you go forward. So it's not the end-all be-all, but it is a good place to, to start giving you some initial information in an affordable, understandable piece of equipment. So that's what I would say. Alex, anything more there?
Yeah, I mean, carbon dioxide is one of the basic elements of evaluating in the indoor environment. And there are other things you can look at. Again, temperature, relative humidity, making sure that the systems are eliminating the humidity in the indoor space and removing it again in humid environments. There are also meters that you can put out there, particulate meters, having different ranges for evaluation. But again, that's verifying your systems are working as they're designed. To have a continual, use of some of those, if you look at, you have to understand there may be differences in how some things react. Like CO2 is a gas versus maybe an aerosol. Transmission and efficiency of those may be different on how your systems are handling those, or how things are clearing out, again, depending on the weight of that material. Making sure that it's done appropriately the first time. Do it with different loads. Do it in an empty classroom. Do it in a classroom that's filled with people as it is intended. The classroom may react differently when people are in there. That's something to keep in mind. You may set it up in a classroom and say, oh, everything's working great. But then when you introduce a bunch of people to the classroom, students or teachers, things will change. The dynamics will change. So you have to understand what it is under different loads. You also have to understand that you can do this testing maybe weekly, maybe quarterly. It doesn't have to be a continual monitoring event, because A, who's going to be monitoring it continually? Are you going to hire somebody to monitor it? B, there are systems that are automated that will send you warnings So you have to evaluate and determine what you're going to do if you receive a warning on the system and how you're going to react. And that may be something we're going to get into later with Carol, looking at infection prevention programs. Is if you have something that happens, how are you going to respond to it to have a corrective action to make sure it's to address it, and what does that reading actually mean? So you need to have somebody, again, whether it's on the district level or even the school level, on an advisory panel, who can interpret that data point and tell you what it means and whether something needs to be done.
So we're having this conversation now, addressing things that we can do now to protect our kids against COVID in schools. But, this conversation comes amid a larger backdrop. Like, what can we do long term is one of my concerns. And I'm thinking of a State of Our Schools report that came out last week showing that schools each year are investing about $85 billion less than is needed just to maintain buildings and achieve modernization. So I guess my question is, how do you capitalize on the attention that is finally being paid now to the state of school facilities to get sort of those longer term resources that we need to reach healthy schools that are, healthy not just now, but for the long term? Because we know that indoor air quality and the state of school facilities can impact student learning, not just student health, but student learning. I guess, and there's action on the Hill going on right now on that. So Allie, I'm going to turn to you and ask you for a little update and what's going on.
Maria, thanks so much for mentioning the State of Our Schools report. I will say that Basics members actually helped craft that report, and we're just incredibly honored to be releasing it at a time that it is literally being used on Capitol Hill. And unfortunately, we've been in just such reactionary modes in the last year and a half. And I think that what we really need to talk about is the long-standing inequities in the ability for low income and underserved communities to be able to modernize our school facilities. And in order to do that, we need a federal program that provides $100 billion in direct grants to ensure that our students and our educators are in safe and healthy and modern and resilient buildings, right? So the 2021 State of Our Schools report released last week shows that there is indeed, and Maria, you said this, an annual gap of $85 billion per year, right? Annual gap, including the capital improvements and maintenance and operations needs. And this gap is going to continue to widen unless the federal government steps in and invests in the school facilities with a targeted focus on the low and wealth and high needs communities, right? These are the communities that don't have the capital to be able to spend what is currently being spent. And despite their best efforts at the local and state levels, which they are indeed spending, they just can't keep up with that widening gap, which again leads to these inequities. And so COVID put a national spotlight on the problematic conditions of our schools, right? It's beyond ventilation, right? It's leaky roofs, it's lead in the water, it's the lack of outdoor spaces for kids to play in and have social and emotional learning, and much, much more. And so again, it's also where millions of educators spend their days in the workplace, which is, terrible when we compare it to other workplaces and how our country looks at, workplace safety, in addition to the fact that kids are in those classrooms. And so research shows over and over and over that the condition of these facilities, beyond just ventilation, which of course is so critical and, for all the reasons Alex and Tracy just mentioned, has a direct impact on the learning and the health and safety of the educators. And so I do want to address just two quick things that are happening on Capitol Hill, and one thing being the narrative of the COVID-19 emergency relief bills. They did, in fact, include health and safety repairs as an allowable use within the COVID-19 packages, specifically in the American Rescue Plan. But the ESSER dollars, right, the COVID relief dollars, did not address the longstanding need for the whole school modernizations, particularly in the low wealth, rural, and high needs communities. So the funds within the elementary and secondary school emergency relief fund, so when I say that, I mean ESSER, were not meant to address those longstanding needs. And so for starters, COVID is not over. And so for all the narrative that's going on out there about, oh, districts are sitting on fat piles of cash because the American Rescue Plan sent billions of dollars to schools. Okay, yes, the government did send billions of dollars to schools, but it was meant to address one of 100 things. I think, Tracy, you mentioned it earlier, that there were like 60 or 70 allowable uses, including learning loss, including summer and after school, including teacher retention. And so the ESSER funds, which we hear from Congress all the time, oh, why do they need more money? They just got all this money in the American Rescue Plan. That is absolutely not true. The COVID money for schools, for K-12 facilities, was just an allowable use, and it did not require the districts to spend that money. So amongst the many other needs, there was also these other competing needs. And so I will say that how these funds are spent on high quality short-term and long-term projects to address the fallout will indeed pave the way for how advocates can go back to Congress and say that we need more funds. But to that effect, in some very good news on Capitol Hill, this past Thursday, the Education and Labor Committee recently introduced in their reconciliation package $82 billion in direct grants for PK-12 facilities in the $3.5 trillion bill that Congress is currently negotiating. And so BASIC, the Build America School Infrastructure Coalition, which again is a group of 140 organizations advocating for these investments at the federal level, is really hyper focused on making sure that the Senate retains that language in whatever bill they put out, and that ultimately President Biden puts that into law. Because again, the funds that were passed within the COVID-19 relief bills were in no way satisfactory to address the long-term needs. And we don't have a federal investment at any level for long-standing capital improvements to bring our schools into the conditions that Tracy and Alex have been alluding to. And so I think if I were to leave this group with one thing, it is that we need all advocacy and hands on deck right now to really get buy-in from Congress, to understand that it is not sufficient to just have these emergency repairs and to do these ad hoc one-offs with very limited dollars, because that is not going to prevent the next natural disaster response. That is not going to make sure that in the next natural or man-made issues that we face every day in schools, that schools are going to be equipped to do this. Again, schools are over 50 years old. I know, I remember we were talking in the before this started that all of us have experience in being in decrepit schools. And again, who does this impact most? This really impacts the students in the most underserved communities and the ones that truly will benefit from the dollars from Congress. And so I think that for a long-term solution, we cannot continue to be as reactionary as we are, because it's not fair to the districts either. They don't have time to plan. They don't understand, all of the moving pieces in Congress from minute to minute that change how dollars are spent. And if they had a direct program and a promise from Congress that recognizes that schools are a vital part of our well-functioning society, then only then will we really see the kind of schools that I think every one of us envisions for our own children and for our own families.
Yeah. And Tracy, I know that this is an issue very near and dear to your heart. I kind of would like to see your wish list for this moment now that we have attention, on the subject.
Oh man, my wish list. So I'll say, be careful what you wish for, right? Because I've spent 25 years wishing the schools and school districts would pay more attention to indoor air quality, and so now here we are, right? And so my wish really is that we do not, everything that Allie's saying, that we don't squander this moment. So Allie's absolutely right. The funds are out there right now that went to Department of Ed under the American Rescue Plan were targeted specifically for response to COVID. And the thing about COVID is, COVID has just ripped the veil off of not just of all of the fissures, of all of the inadequacies that we have in this country when it comes to to providing equitable access to our public services. So whether it's education, whether it's public health, whatever it is, we are seeing where we really need to get our act together, right? And so in this case, I'm I'm looking at COVID as the thin edge of the wedge when it comes to providing better environmental and health equity and educational equity in our schools, right? And all those things are connected, and we're starting to see that now. So while the funds that went out were fully insufficient to doing the sea change that we need to see happen in this country to live into the ideal that we have set up for providing, an appropriate education in a healthy setting to every student and every staff member in this country, while we are certainly not there yet, what it did do was, and I'm so privileged to see this having happened in the lifetime of my career, is it has brought CDC and Department of Ed and Department of Energy and EPA to one table talking about schools. We have never had this opportunity where we are in deliberate, planned, intentional conversations about how we leverage all of our individual agency assets and direct it towards schools. Because my dream, and thanks for asking, Maria, really is that in the same way that the healthcare system has finally started to talk about patient-centered healthcare, right? Where instead of sending the patient all over the place, you put them at the center of an array of services and you bring those services to them. I want to see a student-centered education system where we center and privilege the student and put that array of services around them to help them succeed environmentally, health-wise, academically, and that we as a federal family and we as an American community fund it in a way that demonstrates everything that we say about how important our schools are, everything we say about children are our future, that we actually, put our money where our mouth is around that, provide those services, collectively work together to make it happen so that way, that's what creates that long-term, success there. But we have to decide that our students, all of them are important, that our schools, all of them are actually important, and that students and teachers and administrators and everyone who's involved in that system deserves to walk into a pristine palace of learning every day. We just have to decide that is important and then do the work.
Yeah. I'm going to shift focus a little bit now. And well, actually, there is one thing before we move on from ventilation, there is one thing I wanted to bring up. And that is the concern that schools that we heard earlier this year, that some schools use federal funds to invest in unproven technologies, some vendors were peddling technologies that use ionization or plasma or dry hydrogen peroxide to purify the air, even though there's no real proof that these things work, and in some cases they may do more harm than good. And I'm wondering, do you think that the word is out for those schools? Are you worried that there's some schools out there that invested in these technologies and may be overconfident and they think they're more protected than in fact they are?
So, Alex, I'm going to have you come in here again.
I just want to see. I was giving you that opportunity. So what I always like to say is, if you're being approached with a technology that sounds like it's the best thing ever, you want to have that information evaluated. Have a third-party verification of that information. Ask the vendor, may I have all the data that you have? I want to see your efficacy data to see if it's effective, what you're telling me it actually does. I want to see your safety data, because I want to make sure that system is not introducing something else into the indoor environment that may be harmful. You may be addressing one issue, but introducing a totally separate issue into the indoor environment. I hope that that information, at least, having an evaluation done, has gotten out to school districts. I have heard some that are purchasing systems that may not be as efficient as they may hope they are. And I hope they have some of those evaluations done to determine whether or not they're effective or what they're claiming to be. But if you're approached by these systems, if somebody's saying, this is this is going to take care of all your problems, it is the solution to everything, take a step back. Say, let me find somebody who can do a third-party evaluation and verification of this information. Because I've seen some safety data that has been presented to me that I'll say is questionable. They will, some places I've seen hide behind other safety data. That is a red flag to me. So I think Tracy's probably had an evaluation of some of those, or at least addressed some or received questions on those of what do we do for new technology. So my advice is before you purchase anything, before you spend $100,000, $500,000 on systems for different individual schools, have a third-party evaluation done to make sure that what they're giving you is what there is going to do. There may be cheaper solutions for your ventilation systems. It may be cheaper for you to change something in your systems instead of purchasing these other newer technologies that may have an unproven track record.
So, and what we keep telling schools right now is, this is, in so many cases, I think COVID has created this sort of urgency that, with people where they're looking for these quick fix solutions, and we're like, this is not the time to lose your religion, okay? This is the time to really, all the things that you have been doing that work. Most schools have purchasing protocols around things, but all of a sudden now they think that they're in an emergency situation, and so those protocols go out the window. No, the third-party verification that Alex is talking about is so critical, and this is a place where, especially again, industrial hygienists have such an opportunity to help educate schools and school districts about how to make those, how to make those evaluations around these things. But I will also say, when for government, I would say, you would say, we are not. If you're looking for a revolution, don't go to government. Okay, we don't do revolution, but we do fund coup d'états, right? And so, when we look at how it is, what we can say and what we can say and when, and what we can't say and when. When we say these are the 3 top proven technologies, it's outdoor ventilation, it's enhancing filtration, it's looking then at supplemental air cleaning or air supply. Look at what we say and look at what we don't say. Right, and that is going to be really key to really drilling down, investing in those proven technologies. And as these emerging technologies start to show up, like Alex was saying, if it sounds a little too easy, a little too good to be true, you got to do your due diligence. You've got to do your homework on these things and challenge even some of your trusted vendors at some point. You really want to challenge them to show you the research, the third-party verification, and how these technologies have been used, not just in the lab, but how are they actually performing in the field? Show me data that's similar to the situation that I'm going to use this in, right? So we just all got to do our due diligence around it and stick to the proven technologies as much as you can.
I'm going to pivot now and talk about something that happened last week. President Biden called on schools to require all staff to be vaccinated. Public health experts say that vaccinating everybody who is eligible, who spends time indoors with unvaccinated children, is one of the best ways to protect them. Obviously, mandating vaccination is a controversial topic. There are, it seems that for the most part, these decisions, states are leaving these decisions up at the local school district level. I'm wondering if we can talk about, and Carol, I'm looking to you for this, but everyone is welcome to chime in. But I'm wondering if we could talk about sort of the history of using vaccines as an administrative control, in schools, because obviously we have immunizations. I know as a parent, I got to take that card to the doctor, the pediatrician every year or every few years and have it filled out. My child is up to date. So requiring immunizations is not unprecedented,
Correct. Yeah, no, and thank you so much. And Tracy, I love to hear you talk. Very animated, awesome speaker. But yes, vaccinations, they have been something that have been around for a very long time and have been made because of other outbreaks. So I think historically we've had the measles, mumps, pertussis, all of those type of illnesses, including influenza, have all been illnesses that have impacted our children and including our adults. And so it has been something that's been out there for quite some time, and it is an incredibly effective way to help mitigate that spread and transmission of infection. And for some of our youngest right now, which I think what makes this school age group so challenging because there's so many different levels. Some can have it as far as the COVID vaccine, and others it hasn't been approved yet. The variables are very large within this group, and so the people who are candidates for the vaccine, it absolutely is appropriate speaking with your physician, making sure that, just as we said, not everyone, there's not a one size fits all. So it's very important to have those appropriate dialogue with the physician, with your nurse practitioner, and make sure that you are choosing that decision based on what is going on with your child. So not every kid that goes to school is really very healthy, right? So we do have school classes that are meant for kids that do have some comorbidities and some challenges health-wise. Having our healthcare providers or our school providers vaccinated is another level to be able to prevent that transmission to that child along with their parents. So there's multiple different mechanisms of way of how you prevent the spread by getting the vaccine, but also getting it to help prevent the spread to those who can't have it. And as we all know, they have not been approved for all pediatric patients. And so we do have a subset of our population that we are still waiting for that vaccine. But in the past, we don't see many measles outbreaks anymore. Unfortunately, there are a few that do pop up, but the measles vaccination along with the MMR, they all are very good and sound vaccinations that have been used throughout for decades.
Is there a history of mandating it for staff and teachers too? Mandating vaccinations for staff and teachers?
As far as I know for healthcare workers, yes.
I can't hear you, Carol.
So can you hear me now?
Yes, you're back.
Okay, sorry about that. So yes, there is history of mandating the MMR and Tdap for specific types of school-aged kids, and also for, I know, healthcare workers, depending on what your local and state regulations are. I think it's very important that you have to look at your Department of Health and what is recommended and what is mandated. So working in conjunction with your local area, they will help guide you on what is mandated and what's not. And I know certain areas have started to mandate COVID vaccinations. I know for my state, Illinois, Pritzker has made it a mandate that healthcare workers and those who are working in schools and public and have public jobs should be getting the vaccine. So it is starting to become a mandate in certain areas, depending on what that state and local areas have decided on.
I want to switch to some of the other controls that are available to schools, like physical distancing is one that comes to mind because, last year some schools returned to in-person learning. They had things like they had physical distancing. They also had staggered schedules for students, like an A week and a B week, and not everyone was present at the same time. I don't know that we're seeing that so much now. I mean, it seems like schools are ready, and they made their plans before the rise of Delta when we thought that we were seeing the tail end of this pandemic. And so many students are back at full capacity. There may not necessarily be physical distancing in place. Are you concerned that maybe schools have dropped some of last year's precautions too soon, especially now that we're seeing, just more infectious Delta spreading?
So we have seen a lessening. It's not throughout the nation. I think it all just depends on where the schools are located. And I think what's important to know as far as all of the things, if you have looked at the CDC, they have laid out a very nice layered approach of all the different components, and social distancing obviously is one of those. It is very important to understand if you don't have one of those, you're missing a fundamental component in that layered approach. So if you choose not to social distance, right there you have a huge gap in that potential chain of infection, right? There's an increased risk of continuing on with that transmission. A great example, MMWR had just published at the end of August 27 of a school teacher who was unvaccinated and was symptomatic, took down her mask to read to the students. And unfortunately, there was spread within that, in that actual class. The attack rate was 50%. So there was as far as that layered approach, there were multiple points that were not followed as far as wearing your mask. If you're symptomatic, stay home. And then also vaccine is a layered approach too. So I think it's very important to have to look at it from an entire package, not picking and choosing which approaches you're choosing. And I think I want to continue to reiterate that the one size does not fit all. Every school is built differently. The ventilation is different, but even the size of the classrooms are different. So they may not have the 6 feet in between. And so it's very important that these schools really seek out those experts. Have an infection preventionist there that can help guide you through knowing your organism. So when we teach infection prevention, you got to know what you're dealing with. And if you understand the mechanisms of that organism, then you can understand the different ways to break that chain of infection or understand why the layers of protection are so important. And so if you know your organism, then it kind of logically makes sense of what you need to do. And education. So reach out to your experts, make sure that you have your correct people giving you that information. And really education on all of this should go down, start from the top and go all the way down to the bottom. Make sure that the parents are just as involved and understand with the students. So infection prevention is very challenging because we like to include all of the variables. There's so many variables that can potentially transmit. And now we're looking at schools, and schools have more than enough variables. Kids who can wear masks, kids who can't wear masks, kids who can get vaccinated, those who can't, old school buildings, windows that can't open. So every school district needs to look at them as their own little capsule and how they're going to create processes so that they can check to ensure that the processes are actually being done. And what do we do when there is an outbreak? So ensuring that we have those mechanisms in place, that we don't get too frenzied, we're calm, cool, and collected, and that we can notify the appropriate people if anything were to occur that was outside of the norm.
And I just want to
thank you so much for that answer, Carol. Oh, go ahead.
No,
yeah.
I just want, and what Carol says is so important there, especially about the sort of cherry picking of, of interventions and of actions. And so, we always, there are questions that are coming in now about schools that, they don't either they don't have mechanical systems or they don't have operable windows. And so kind of what do we do there? And that's when it becomes really important to be balancing out, again, these administrative controls with the engineering controls, balancing out the choices that you're making about things like social distancing and masking that are specific to the situation that you have with what you can do engineering-wise, right? And so, but for instance, when CDC said, revised their distancing from 6 feet to 3 feet in schools, right? And said, okay, well, 3 feet may be okay. Well, people just globbed onto that, but that doesn't mean for everybody. That's not for everybody. That's not, okay. So no, not if you haven't optimized your ventilation to the best you can, whatever your situation is. No, if you're not doing anything else with staggering schedules or creating other social distancing or mitigating for that 3 feet that you've lost, that is in concert with everything else. You don't just get to pick, now we're going to go from 6 feet to 3 feet without doing anything else. So it really is a matter of constantly evaluating and assessing your individual environment, looking at all of the recommendations, getting some professional help in to help you as well, training your staff, and then making the selection of creating the complement that is going to be optimal for that situation. Otherwise, it's just theater. We're just going to the show.
Thanks, Tracy. And Ed, I see you've come up on screen. We promised to leave some time for audience questions, and you've been collecting those for us now. Would you want to read them out for our panelists now? Ed?
Can you hear me okay, Maria?
Yes. Yes.
Okay. Just a reminder, if you have a question, please type them into the chat module in the bottom right corner of your screen. The first question comes from Dan. I'm not sure who would be the best person to direct this to. And he writes, in my country, some claim that wearing a mask can create psychological issues with kids. Do you have any studies providing evidence for that?
I will say I am not a pediatrician, I'm not a child psychologist. I have seen studies that have been published that evaluate the emotional reading of children's faces and the impact that masks may have. Because again, no other time really in that, that we can remember, kids have worn masks for this long or for this duration. So I know as a parent of two young children that if I see them in a mask, sometimes I have a hard time reading their face. So it's important to that's all part of the layered approach. So the consideration of what impact it may have on their either learning or understanding or language, again, as a parent, in relation to, again, shifting the burden to the facility, to the building, and look at the ventilation and seeing how that can be the most effective mitigating factor that we're looking at here. But again, as a parent of two children.
Okay, thanks, Alex. Next question comes from Kyle, and I think this one might be another one for you, Alex. He says, I'm wondering why upper air UVC is not being implemented more widely when studies show that it is the most effective means of providing ancillary ventilation. Maybe because it is difficult to measure as the virus is not removed, it's just inactivated?
That could be a reason. I mean, there have been studies that I've seen that evaluate the efficacy of UVC, but I think that those, again, need to be a complement to what we do in ventilation. If it's upper air, you have to make sure that there's enough turbulent air for it to get up into the zone of deactivation for those units. If there are areas where you're implementing something where the air is not in a I'll call it a laminar flow for an example, where it's just a straight flow from the diffuser to the return, the air may not be getting to where it may be effective. Again, the inactivation of the virus versus eliminating it through filtration, it may be a complement, but I think focusing on the effectiveness of the ventilation is going to be, I'd say, the most important thing. Because again, we were talking about distancing earlier and 3 feet versus 6 feet. If you have an aerosol, it's going to travel longer than 6 feet. It's going to be in the air for minutes and hours. The most effective way is getting rid of it is to have a high air exchange rate in the facility. Again, that's cubic feet of air, not just square feet. People understand the volumes of rooms. You have to move those air exchanges and try and get as high as you can, 5, 6, 7, or even 8 air exchanges per hour, which that's not going to be feasible for all facilities. But I think a complement of outdoor air, using your existing facilities and portable HEPA machines will help you get towards at least that 6 air exchanges per hour to effectively remove those aerosols. Carol, I don't know if you had any additional information on that.
No, I think you actually hit it very well.
Thank you.
Okay, thank you. Let's try and squeeze one more in here. This is from Jason. He has a question for Tracy and Alex. Even with the availability of all the guidance documents, were there any lessons learned and subsequent changes to how schools manage ventilation systems and administrative controls in response to outbreaks or elevated transmissions within a school population?
So we to be able to answer kind of quickly, because I know we're kind of running out of time. But yes, I think that there are. I think that we are starting to see examples of where school districts have, especially, sort of taken some of those ARP funds. And in other cases, they didn't wait for ARP funds. They really started to reallocate money to be able to do one. I think one of the most important things that people started to do was do the individual assessments of each one of their facilities with their staff, and then with other consultants who came in, assessed their systems, and devised, individual plans for what they needed to do. I think that's been one of the key things, and they really have started to get facilities folks and their operations people and their custodial staff in the same room with their planning folks and with their administrative, folks, and they have put them have started to put them at the center of the conversation. And so I think that has been probably one of the best administrative changes that have been able to support long-term engineering control changes in the long run, is how schools and school districts are operating with one another. Alex?
I agree. And I think everything's like a bell curve. There are going to be some on the end that are going to be entirely great, some that are going to be in the middle, and others are going to be on the lower end. I have run into, I'll say, pushback on some conversations. And, there's a lack of want sometimes of outside help. But I think it's important to understand that, in the industrial hygiene world, usually when I deal with school districts, they are reactive scenarios. They call us in when they still have things that are so messed up, they need someone to help them with it. The goal of what we're doing, the goal of what I'd like to do, is be a proactive source for these people, work with them moving forward, understand that we are there to help them. We're not there to hinder them. We're not there to make them, do something that they don't want to do because they don't think it's the best. We're giving them the best science to move them forward so we can work together in unison and give these facilities the best environment, as Ali discussed, as Tracy discussed, the best environment for learning, the best environment for occupation, for teachers and staff and facilities people, because working together will help us get ahead of some of these maintenance issues that I continually come across, some of these issues where we're playing catch up continually. I think that it's important for those districts to understand that we're there as help. We're not there to hurt. I know some districts definitely do. And I've talked to some of those, but others, I want them to understand that we can move things forward together.
Great. Thanks, Alex. And that's unfortunately all the time we have for today. So Tracy, Ali, Alex, Carol, and Maria, thanks so much for such a wonderful discussion. Really interesting. I'd like to also thank all of our participants and to Safe Traces for sponsoring today's webinar. Please join us tomorrow at 2 p.m. Eastern for our next Synergist webinar on how European regulators enforce recycling regulations. Thank you again, and have a great day.
Thank you, everyone.
Thank you. Bye.
All right. This was great. Thank you, everyone. This actually concludes today's webcast. Thank you all for attending. The recording will be available at aiha.webvent.tv. We will send all registrants an email tomorrow with that link. And please visit our event calendar to sign up for future webcasts.